In our first segment, we'll visit the Tampa Eye Laser Center with award-winning surgeon Dr. David Leach, who has spent the last 20 years setting new standards in LASIK safety. He'll also tell us about his Relax LASIK technique, which calms patients and alleviates much of the anxiety surrounding the procedure. If you've ever considered LASIK eye surgery but were concerned about safety or question the results, our next segment will be of interest to you.
I received LASIK surgery over 15 years ago, and while the procedure was still in its infancy, I continue to have 20/20 vision.
I also recently decided it was time to throw away my glasses and get LASIK. My only regret is waiting so long.
Now he's got 20/15. With improved lasers, safety techniques, and the ability to correct a wider range of visual problems, maybe it's time for you to seek out LASIK surgery from someone in your area.
I have been wearing glasses since I was 5. I am completely and totally dependent upon glasses. If I were to lose my glasses today, I couldn't drive home.
Well, I had a really high prescription, so I had to wear contacts all the time. I hated wearing my glasses because they were very thick, the old like Coke bottle lens kind of thing.
I put my makeup on by feel. I can't see to put makeup on.
It was basically incapacitating if I didn't have any kind of correction going on.
Since I have been working with Dr. Leach, he is the first refractive surgeon that I have seen the results in that they have been on a consistent basis. I have patients who are 10, 15, 20 years out who still maintain 20/20 vision.
Now, for those who aren't familiar with LASIK, just explain briefly what it is.
Sure. Well, LASIK has evolved over the years. When we first started doing LASIK, when I first started getting involved in this procedure, it was 18 years ago. So we had different lasers, different techniques, and different ways of correcting vision. The standard procedure that we call LASIK right now involves 2 lasers. The first laser is a laser that makes the flap. It's a very thin flap. It is a fraction of an inch. That flap is created with the laser. It is then developed at a second laser, and the cornea is reshaped to correct the vision. And the vision can be corrected if you have nearsightedness, farsightedness, or astigmatism. Depending on the condition you have, for example, with nearsightedness, you try to flatten the cornea. For farsightedness, you try to steepen the cornea. And when you have astigmatism, that means the eye is shaped more like a football, and you correct the vision to try to make that surface more round. So the standard LASIK procedure involves 2 lasers now. It's gentler and more precise than ever with these tracking lasers.
And when you had it done, which was 2001?
15 years ago,
Yeah.
yes.
They actually used a blade.
They did. Was it called a keratome? Or
It was called a microkeratome, and it was an oscillating, high-speed oscillating blade, and it was good in it for its day. But with most technologies and in science in general, we have developments that make things better, and so our precision with the tracking lasers is better than ever. The laser we have right now is called the Wavelight Allegretto. It's a 400 hertz laser. It tracks the eye at 400 cycles per second. So it's dramatically faster than what I was used to in the early days. With that, you get better precision. You get better results. You're able to correct higher degrees of nearsightedness and farsightedness and higher degrees of astigmatism.
Who would be a candidate for LASIK?
For LASIK, you know, anybody that has nearsightedness or farsightedness and has astigmatism, we can correct them. We cannot correct the problem that you develop as you get older in your 40s. That is the inability to see up close. That's called presbyopia, unless we have a situation where we make one eye for distance and one eye for near.
So there's a lot of talk about cutting and lasers and flipping corneas and doing different things. How do you put people at ease when they come in for the procedure? Because obviously they're thinking, it's my eyesight.
I was nervous. I thought, I'll be honest with you,
Yeah.
I thought if I had lost my eyesight, I don't know what I would do.
I thought about that.
I was pretty anxious myself.
As I was in surgery myself.
So how do you put people at ease?
This is the age-old question. You know, this is something that we face in medicine every day. There are a lot of people that are just concerned and have anxiety over seeing a doctor in general, but a doctor with a white coat, for example, the white coat syndrome. So we realize this in LASIK. You know, I've had 18 years experience with this, and we know that there's 2 barriers to having the LASIK procedure. One barrier, of course, is the cost issue, which we can overcome in various ways. But the other bigger issue for a lot of people is the fear, the anxiety of having this procedure. And so we know that relaxation is a state of mind. So what we try to do when the patient comes in the door, we try to get them to a state of mind where they're relaxed.
Sure.
And that means from the moment they walk in the door to the person they greet, through the whole process from beginning to end. We want to do everything we can to make them feel comfortable and relaxed.
My husband brought me today, and for the person who is providing the transportation for the patient, they will receive a complimentary facial. And my husband is super, super excited about that.
Now, years ago, if I heard that if you had cataract surgery, you couldn't be a candidate for LASIK. Is that still the case now?
Well, that's not quite true. In the early years, it wasn't approved for that. Now, we're actually using this more and more to help people to be even better post-operatively from a cataract surgery. With cataract surgery, it doesn't have that same level of perfection that you have with LASIK. And so if they have a little bit of leftover nearsightedness or farsightedness in a cataract post-cataract surgical patient, we can tweak that. We can bring that up to a better level. We can make that person see even better.
And I wanted to mention cataract surgery because we were talking prior to taping here that my grandmother had cataract surgery probably 25 years ago, and I remember it was just terrible. She had to wear these blue blockers for a month, and the recovery time was just super long, and it's not like that anymore, right?
Cataract surgery has become almost a refractive surgery type procedure. I mean, similar to LASIK in the sense that the patients that come in for cataract surgery, they want to have that same kind of vision, and so we strive for that. I do cataract surgery as well. And we strive to get our patients with cataract surgery seen as best as they possibly can, given their circumstances.
And it's dramatic how instant it is, too. I mean, yes. I got it done. They did both eyes. I sat up, and before they laid me down, I looked at the digital clock on the wall, and it was blurry. 3 minutes later, they seat me up, and it's crystal clear. I mean, it was that quick.
Well, it's pretty quick. You know, we tell people the next day that they can do anything they want to do with the exception of getting water or debris in their eyes. So, you know, we literally have had weightlifters, we've had marathoners, Iron men, Iron women, and they get right back at it, you know, running, playing, doing any sport that they want to do, with the exception of getting water in the eye. So we avoid that for the first couple weeks or so, and debris. But you know, anybody that's active can stay active. We don't let anybody sit on the couch and eat potato chips. They need to go, they need to get back at it.
How long does it take the eye to heal?
Well, the eye is one of the fastest healing organs in the body. It's remarkable. The surface heals literally overnight. The deep down healing takes place over the course of several weeks. So again, that's why we can get these kind of results, because the healing process is so fast. It's hard to get that in any other structure because the surface cells heal so quickly that it allows us to do that.
I don't know about you, Ethan, but speaking personally from my experience, the most painful part of LASIK for me were the eye drops. That very first eye drop hurt more than the whole procedure.
Especially the real thick ones that you had to put in there. They sting a little bit.
Right. Well, the surface is a little dry at the beginning, on day one in the first few hours, and so people do feel that way. But that quickly subsides, again, as the surface heals itself.
I mean, before, when I was putting my glasses down, I was like, can I even see my bag to put them in there? Like, that's how high my prescription was. But now, you know, I'm comfortable. You know, I can see the hallway there, and you know, the door and everything, so I feel a lot more comfortable just with my surroundings and environment.
You know, I still have, you know, everything's a little cloudy, almost like you've been swimming underwater, but I see detail. For the first time in my life, I see detail.